That would be one of the anticipated outcomes of this procedure, that if you're having some bladder distension, that the Foley catheter will definitely help with that. Okay, so Teresa, would you mind reading me some of the steps of the skill so I know that I go point by point?
Sure. Okay, upon entering the room, hand hygiene, you did. Identify patient, you did. Check allergies, you did. Identify self. Assure privacy. Explain what's about to occur. Allow for questions. Raise bed to comfortable working height. And don clean gloves.
Okay. Do you have any questions for me before I start this procedure?
No, ma'am.
Okay. Okay.
Adjust for proper lighting and position patient in lithotomy position.
All right. So I can check on here. Okay.
Okay, and then you would place a waterproof pad.
All right. Okay.
All right, and then
Now
you're
I'm
ready
going
to
to
cleanse.
Clean.
Okay.
Going front to back. Okay.
All right, so remove and discard gloves, wash hands. Now you're ready to open the catheter kit, taking note of expiration date and package patency.
Okay. Let's take it. Doesn't look like it says open, and the expiration date is 2012. And I'm going to open this on the bed between your legs.
Plastic
Garbage.
bag turned into garbage at her side, kind of by her hand there.
Okay, so I'm going to open this with sterile technique. So the first flap will go away from me, because I don't want to go over my field with the last flap. And now I'm going to, the first thing in there are my gloves, and I'm going to put my sterile gloves on. So I'm going to take this out. Keeping an eye on my sterile field. And I pick up the first glove with the folded cuff. Pick up my hand, slide my hand in there, and then I go inside the cuff. Open it up, watch my thumb, watch my pinky so I don't contaminate any. Then I'm going to take the first drape. And I'm going to protect my sterile hands as I put it under this is the fenestrated one. We use this for men, so we don't need that for here, so we can just get rid of that. And then I'm going to prepare my items that I need for the catheter insertion. So I'm going to move this out of the box. I'm going to open my betadine package. I'm going to use my lube. Teresa, I'm going to ask if you could just help me for a second. Can
Sure.
You just, because these are mannequins, we can't use the actual lubricant, but if it were, I would just squeeze that out, but my assistant here will. Then I need to get my catheter ready. You don't want it flapping around, so you have to be very careful about taking it out of the package so we don't accidentally contaminate. And then we take our saline or sterile water syringe, and then you need to insert it into this little
Port.
and test to make sure that your balloon is functioning. So you go ahead, the balloon is expanding, so, and there's no leaking, so that is good to go. I'm going to take back the fluid, and then I'm going to lube up 1 to 2 inches of the catheter tip to get it ready for easy insertion. I'm just going to rest that you notice I leave the syringe connected. Okay, so at this point, I'm going to have my non-dominant hand, which is my left hand, to be non-sterile now because I need to hold her labia open, and then I'll use my sterile hand to clean. So you would open up the labia, take one swab, and you're going to wipe it with it would be the left side of the labia from front to back. And then you're going to discard. And then the second one. And then down. Discard. And then the third one, and it's just going right down the center from the top down to the bottom again, always clean to dirty. Then you're going to take your catheter and you're going to look for your urinary meatus. Find it, and you just insert. While you're inserting, you're going to watch for urine flow. And I see the urine. And so I go another inch actually before I inflate the balloon. Hold it with your non-dominant hand because right here it's external to her, so it doesn't need to be sterile. I'm going to inflate the balloon. How are you feeling?
Much better. Thank you.
Wonderful. Yeah, we have a nice amount of urine coming into this bag. I'll go under her leg. No, I'm going to hook it onto a non-movable part of the bed, and there's a nice convenient hook for us. You can pull back a little bit. You would tape it to her leg. And a lot of facilities have special Velcro that you can use. If not, this is what we do. We tape it with a little bridge. You see the bridge?
Mm-hmm.
Okay. And then you would clean up your supplies. Assist her back to a comfortable position. Well, I'm glad that did the trick for your bladder distension.
Me too.
Remove gloves, wash hands. Everything looks, urine's draining. Okay, well, I hope, is the bladder distension, like on a scale of 0 to 10, how would you rate your pain now?
0.
Wonderful. Okay. Is there anything else I can do for you?